Good morning, David. I think that we need to take everything, with some caution, because we do not have enough data yet about that variant. What we know so far, that it is a descendant. It's like a grandchild of the Delta variant. We suspect, and this is based on some reports we got from the UK, that this variant might be a little bit more contagious, around 10% more contagious. And right now, it is the fastest rising, I would say, sub-variant of the Delta variant in the UK, totaling around 8% of the new cases. It moved from a few, I would say, tenths of percent to 8% within a short period of time. On the other hand, again, there are a lot of infections in the UK, so I'm not sure that, this is really the whole story. We need to follow on that variant to be sure that we will contain it if it comes to Israel.
Now, we're seeing more of these statistics supporting the vaccine's efficacy here, this breakthrough science that emerged so quickly here during the pandemic. Now, is this allaying the fears? And is Israel producing the most cutting-edge data now on the vaccine still worldwide?
Yes, definitely. I mean, we have to take into account that we are pioneers in vaccines. I have to remind you perhaps that, by March, Israel was, the leading, I would call that the vaccination. We were, the nation with the most vaccinated people, and that was, for, I would say, a long time. So we had a lot of experience in terms of, being the first to vaccinate massively. The effect of the vaccination, also in particular populations like 12 to 15. This is actually, the work you just mentioned. And also for the booster shot, 40%, more than 40% of the Israeli population is already vaccinated with that booster shot, while, other countries haven't reached that level. So it's true, we have more data, and we are very happy to share that data with the world so that they can learn from us.
Now, on the other side of this, the data already supporting this, though, but under review by the FDA and the CDC, the kids age 5 to 11 may soon open up to the vaccine. Will Israel, what's your take? Will Israel immediately open it up to 5 to 11-year-olds when the FDA says go?
Immediately, I don't know. We are waiting to hear from the FDA. We should hear from that, committee, the advisory committee, by the end of this month. And I think that then our committees here in the Ministry of Health will start, deliberating what we should do. The big question today, I think, is should we recommend vaccination, especially that, the numbers are, being low and are continuing to be low in Israel, and I hope that they will continue to go down, or should we just open the vaccination and let parents, together with their doctors, decide if it is appropriate to vaccinate or not their children? So this is a big question. I think it's a bit early until we see the data. I think it's a bit early to say if we're gonna, go full gas into that, full speed into that vaccination program, or do that gradually. We also see, I hope that we'll have more data from other countries like the US, see what the experience is with the vaccination of children.
Dr. Cyrille Cohen, as always, important topics that we take on with you. Thanks for your time.